Hey, welcome on the show. I really appreciate you coming on.
Thank you so much. I will enjoy visiting with you.
Yes,
today.
I know. So I know I've seen you for many years.
Yes.
I think that we stopped. I think you would something happened with insurance or whatever, but I think you stopped seeing me in 2020, and then you recently came back to see me again. So if you could tell us a little bit about your history and what brought you to see me in the first place, and then I'll give it.
Sure.
Yeah.
Actually, in the first place, I came because of my son, who is an alcoholic and having trouble with recovery. And he came to you, and he hasn't been drinking since.
Awesome.
And that was years and years ago.
Yeah.
So, so if I needed anything like mental health or help with things, you were the person that I would go to because you understood what they were going through and could understand their reaction to medication, saying that's because of this or that's because of that. And I broke my leg, and I've had cancer, and I had all kinds of things, and I was getting really depressed. And I tried to, my internist to give me Prestige. And she said, oh, well, I don't do that. You have to go to someone else. And I asked 3 of my doctors, and they all said the same thing.
Because I had when I had last seen you, and I think we had stopped seeing each other in 2020, a few years ago. I think you were on Prestige for me, right?
Yeah.
Right.
And then they gave me Prestige, and all of a sudden they weren't going to give it to me. I don't know what happened. I think when my insurance went to Providence, they changed the rules.
Yeah.
Because they wouldn't give it to me, and so I reached out to you, and surprise, surprise. And in 2 days after being on the Prestige, I feel totally different. Oh, I'm back to my old self.
Well, that's the goal. What you just said, back to my old self. That's what I strive for with every patient, because that's the point of taking these medications is they're re-achieving a normal balance of your neurochemicals, and the neurochemicals go out of balance for reasons you have no control over. So that is exactly the point, is feeling yourself. But not only that, I think you said that it helps your arthritis pain, and tell me about that.
The Prestige, I don't know. My pain doctor that I had gone to said that the Prestige affects the nerve endings some way. Mm-hmm. And they all smile at me, like and roll their eyes when I say, it works, and they go, all right, well, if you want to take it, try it. And I said, I know it works because I've been taking it. And, as soon as I went on it, because I have terrible arthritis, and in my back and on my knees, and it totally eases. It doesn't get rid of the pain, but it eases the pain. I can lay down and go to sleep.
Well, and also the ability to handle the pain better, because when you're feeling better and your stress level's down and your mood is better, you're going to be able to handle things better.
Because I wasn't able to. I have a tri-level house, so going up and down the stairs all the time was just killing me. Mm-hmm. Well, since I've been on the Prestige, I can go up and down the stairs. I'm cranky as can be, but I know I'm better.
Well, again, this is something, I discovered about 30 years ago, 31 years ago, actually, in 1993. I talk about this in my books too, but at that time, all we had was SSRIs, Zoloft, Prozac, and Paxil. And Effexor XR came out in 1993. A year after I started practice, and I just saw a huge difference with my patients. And the thing that really struck me was how their pain was getting better. And I thought, it has to be the norepinephrine, because that's what it does. It balances serotonin and norepinephrine. I said, it's got to be the norepinephrine. That's how it's different than the other ones. And so I started seeing in the 1990s a consistent improvement of pain. And this led to, and then the second one was Cymbalta. And Cymbalta kind of got some attention because some of the pain doctors started to say, hey, that works for pain. Well, I knew that 10 years prior to that, and Cymbalta is not quite as good as Prestige or Effexor. Well,
not at all. Neither is that a Fixer or whatever you call it.
Right.
That one didn't do anything.
So then they made them improved on the product and then came out with Prestige, which has been the number one thing I prescribed for many years now.
It's wonderful.
But it is a wonderful medication. It's my favorite. I call it the wonder drug for a reason. And then with your son, I remember your son, and when someone struggles with addiction or alcoholism or whatever, it's always my question is, why are they self-medicating? Okay, they're self-medicating for a reason. They're trying to, and so typically the alcohol will soothe the anxiety, or the uppers will improve depression, or so when I always try to ask someone who's struggling with addiction is, and I try to get under the surface and find out what's going on, and then that's when I choose medications for them, it's just based on trying to give them what they want in a non-addictive way, and
have a balance, yeah.
And have a balance, yeah. And then it's not that it always works, because they have to make a choice to stop, and a lot of times they struggle with that because they don't really want to, and then or they think that they can just do it socially, and they often can't, and so that's tough to convince somebody about that sometimes, but
when my son finally came to us and said, please help me, because he'd been in rehab and stuff.
Yeah.
And he was really serious this time, and you gave him, I can't remember, a couple of different drugs.
Right.
And it was just amazing, because his head was screwed on right.
Right.
Now. He said it was just like having a record playing all the time.
Mm-hmm.
That just one drink, I'll just have one drink, have one drink. And that doesn't happen anymore.
Mm-hmm. Yeah, and it usually is not as easy as you are. I mean, you're just Prestige only, but a lot of my patients are on a combination of things, and to really do the best job. But like I said, in your case, there's really no evidence that you're going to need anything else besides that, and and then I'm just going to keep you on it, and you're going to just continue to feel great. So, but
at 83, I'll go out dancing.
Exactly. Well, my dad's 88, so you're 5 years behind him, and he's still healthy and still doing well. So yeah. So but there's no reason. And people say, "Well, shouldn't I stop it at a certain?" Why would you stop it? And aren't I too old to? No, too old to what? Too old to feel good? That's ridiculous. So people try to but the drug is. I looked it up. It's only indicated up until the age of 65. I said, well, that's because that's how they study. When the government studies medication, they study certain age groups. So they can't say, you can't say, give it to someone who's less than 18, even though I do all the time. Or they can't say, give it to someone over 65, but I still do it all the time. I don't care what the government says. They don't. But I understand how studies are, and that they can't say things they don't study. So I get that. But hopefully the doctor doesn't pull the rug under you and say, "Oh, well, you're too old to take this now." It's like, no, that's wrong, and so that's absolutely ridiculous. So, but anyway, it's always such a pleasure to talk to you. I really enjoy our conversations, and
I will see you.
I'll see you soon then.
My refills.
Sounds great. I'll talk to you soon.
Thank you so
All right.
much. Bye.
Bye. So, anyways, this patient, she's such a pleasure. She's such a joyful person. I really enjoy talking to her every time. But again, with her, it's the simplest thing I do is, again, most doctors treat people SSRIs, selective serotonin reuptake inhibitors. So there's a leak at the serotonin site here. And so what they do is they fix the leak. So it attaches there. It forces serotonin to move properly forward. So the SNRI, this serotonin norepinephrine reuptake inhibitor, again, this is again the basis of what started my whole practice, what started my books, what started everything that I do, is that simple thing about adding the balancing norepinephrine. And as simple as it is, and the fact that I've learned it for over 30 years now, most doctors to this day don't understand it. And as she said in the call, she went to different doctors and they refused to give it to her, even though she told them at work. They still didn't give it to her because, oh, I don't want to do that, or I don't know, I know I only know how to give Lexapro and Zoloft, and so a lot of doctors just don't do anything. And again, the fact that even she tells them that and they say no, it just shows the ignorance out there. But again, this is a simple case. It oftentimes gets more complex with dopamine and things, but with her case, she has good energy. There's no reason that I see to add anything else. And then I'm going to continue on that the rest of her life too. So.